Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the ESRD NCC COVID webpage, usually within 3 business days. Many times we have the recording up on the webpage well before 3 business days. Let's take a look at the agenda for today's call. Today we are pleased to have Keely Lenoir, who is the manager of the Kidney Community Emergency Response Program, also known as KCER. We will introduce Keely in greater detail shortly. Our topic for today is preparing for hurricane season during COVID-19. After the presentation, we will have time for question and answers. This does not mean you have to wait until the end of the presentation to ask your question. As your questions arise, please submit them using the chat feature through WebEx. Our goal is to answer as many questions as time allows. So, what's this call about? You will learn about tropical cyclones and the 2021 Atlantic hurricane season. You'll hear tips on preparing for the 2021 hurricane season. You'll learn how COVID may impact your planning this year, and you'll get some KCER resources for additional support. Before we start with our presentation, we wanted to share with you a new resource recently added to the NCC website. The COVID-19 trend maps are developed by the ESRD NCC and the KCER team. The maps show COVID-positive case rates among the general population and the ESRD population. Maps are organized by ESRD network service areas in color and in black and white. The ESRD NCC encourages you to share these maps with your facilities, transplant centers, and all ESRD patients. Next slide, please. So let's get to know our speaker a little better and begin our presentation. Keely Lenoir has over 10 years of experience in the field of healthcare emergency management. Keely currently serves as the KCER program manager, providing technical assistance and support related to emergency management to ESRD networks, providers, patients, and other stakeholders. She is experienced in all aspects of disaster preparedness, including planning, training, evaluating, and response. Keely has worked closely with partners from across the country to support the development, implementation, evaluation, and improvement of public health across all phases of emergency management. Keely, thank you for being with us today.
Thank you so much, Jerome, and thank you to the NCC for allowing us to participate in today's webinar. I think it's very timely, given that hurricane season starts a week from today. So if we could go to the next slide. Perfect. So we're going to start today's webinar with a short video from the National Oceanic and Atmospheric Administration, or NOAA. And this video just briefly covers the 2021 Atlantic hurricane season predictions, and this was released just last week on May 20th. So as everyone just heard, NOAA is predicting an active hurricane season this year, but I think for me, the most important part of that video is to remember that it really only takes one storm to cause devastating damage to your area. So no matter what the predictions are each year, it is very important to make sure that we are all prepared every year before moving into hurricane season. So before we move into our preparedness planning tools and tips for today, we're going to talk a little bit about some basic facts related to hurricanes. So people often ask if there's a difference between tropical cyclones and hurricanes. So a tropical cyclone is the generic term used by meteorologists to describe a rotating organized system of clouds and thunderstorms that originates over tropical or subtropical waters and has closed low-level circulation. So depending on where the storm occurs, you may hear different terms used to describe this weather phenomenon. And some of those other terms are typhoon, cyclone, or hurricane. And for most of us that are here today, we're most likely used to hearing the term hurricane, as hurricane is the term that is used for tropical cyclones that form over the Atlantic Ocean and Eastern Pacific. So how does a storm become a hurricane? A hurricane starts out as a tropical disturbance, and this is an area over warm ocean waters where rain clouds are building. A tropical disturbance then sometimes grows into a tropical depression, and this is an area of rotating thunderstorms with winds of 38 miles per hour or less. Once those winds reach 39 miles an hour, a tropical depression becomes a tropical storm. And then a hurricane forms once those winds reach 74 miles an hour or greater. So I'm sure all of us are pretty familiar with the different categories of hurricanes. The scale that is used to measure the strength of a hurricane and the potential damage it may cause is called the Saffir-Simpson hurricane scale. So I think the most important thing to note about tropical storms or the categories of hurricanes is that even a tropical storm or Category 1 hurricane can cause significant impacts to your area. There can still be dangerous storm surge, flooding, tornadoes. So no matter how intense a storm is predicted to be, it's very important to pay close attention to watches and warnings, and then, of course, listen to what the authorities are saying in your area in terms of evacuations and planning, and any other tips that they are giving you to prepare for that storm. So I think this map is a really good reminder that if you live in a coastal state, you always need to be prepared for hurricane season. But it's also really important to remember that hurricanes are not just a coastal problem. The wind, rain, water, and tornadoes from a hurricane can happen really far inland from where that hurricane or tropical storm makes landfall. So as you can see, there is really not a single state along the eastern U.S. coastline or the Gulf Coast that has not been impacted from a storm. And there's definitely a lot of lines on this picture here. And the data here goes back all the way back to 1851 for the Atlantic and 1949 for the Pacific. So I think, you know, the most important thing to think here is don't use past storms as a predictor for future impacts. So just because you maybe have not been impacted in your area by a storm in recent years, or there was a storm that impacted your area that maybe did not cause significant damage, don't use that as a predictor for being prepared for future storms, because it does not mean that the next storm will not cause significant impacts to your area. So this is just another great graphic that I like to share with folks to give you guys an understanding of where storms have made impact along the U.S. coastline in previous years. So I'll just leave this up for a second so everyone has a chance to look at it. But as you can see, there have been a significant number of impacts all along the Gulf Coast and the eastern U.S. coastline going back, this goes back as far back as 1950. Anywhere from Category 1 all the way up to Category 5. All right. Now we're going to transition into discussing some tips and tools for getting prepared for the 2021 hurricane season. So the official start to the Atlantic hurricane season is 1 week from today on June 1st. And the Eastern Pacific hurricane season actually started on May the 15th. So we are already 10 days into that season. But that does not mean that you should wait to get prepared. The National Hurricane Center has actually already been monitoring several disturbances, one of which became our first named storm in the Atlantic late last week. So these early storms should really serve as a reminder that hurricane season is coming and that we all need to have our plans ready now. Don't wait. There are a ton of helpful tools and resources available online to help you with creating an emergency action plan for your family. We will be sharing some links at the end of this presentation that'll take you to trusted sites where you can find resources to start your planning today. So this year, as with last year, it's very important to remain flexible and understand that your planning may be different this year due to the ongoing COVID-19 pandemic. We're going to go into a little bit more detail about evacuations, sheltering, transportation over the next couple of slides. But I think, you know, just remember that we all know how life has changed over the last year due to COVID-19, and keep all of that in mind as you move into your planning for hurricane season this year. But for now, I want to talk a little bit about how, once you have your plan in place, you need to share your plan with the people in your life, with your loved ones, your family members, maybe your neighbors, friends, or even congregation members. Make sure that the people who you are in contact with on a regular basis know what your plan is in the event that there is a hurricane or any other major disaster that impacts your area. You also need to make sure you are discussing your plan with your dialysis facility. So you need to make sure that you are providing them with your correct, up-to-date address and contact information so that they're able to contact you after the storm to make sure you are okay, and also to get you back into the facility or to an alternate location for treatment. Another important thing I want to note here is we've had dialysis providers in the past tell us that after the impacts of a storm, the staff are often trying to get in contact with the patients from their personal cell phones, maybe their home phones, or phone numbers that are not physically the dialysis clinic's phone number. And a lot of times they have difficulty reaching patients because the patients do not recognize that phone number that is calling. So just one tip I wanted to give is during an emergency or disaster, make sure you are answering your phone because your dialysis provider will be trying to get in contact with you to make sure that you are okay and to try to get you back into the facility for treatment. So even if you don't recognize the number that's calling you, either, you know, send it to voicemail and then call that number back, or just try to answer the phone if you can. You also want to make sure you have a backup plan to get care if your dialysis facility is closed. This is something that you should be discussing with your facility every year, and again prior to any impending storms. So make sure that you're having those ongoing discussions with your dialysis facility. And also, you need to make sure that you keep a record of your dialysis facility's address and current contact information. And some of the larger providers have 1-800 patient assistant lines that you need to make sure you have those numbers handy as well. That way, that if you need to get in contact with your facility following the storm, you do have that information handy. You also want to make sure that you are getting prepared with your emergency supply kits. You want to be sure to have enough supplies for all of your household members. And there's long list here of items that you should consider including in your kit. And again, you can find a ton of resources all across the internet, through FEMA, NOAA, the KCER website. There's a ton of resources to help you with walking you through building these kits. If you may have to evacuate, it's also very important to have your go kit ready. And you want to make sure you have that packed in an easily transportable container, maybe a rolling suitcase or plastic bins, something that you can grab quickly, that you are able to pick up and get into your car if you do have to leave your home. Remember that after a hurricane, you really may not have access to a lot of these supplies for days or sometimes even weeks if your area experiences significant impacts from the storm. I also think it's really important to point out that we know that not everyone can afford to respond by stocking up on the necessities last minute. So there are some tips, out there to help you with kind of gathering up those supplies over time and slowly building up your supplies in advance. This will really allow for you to have longer periods between your shopping trips and hopefully not make as much of an impact on you financially as you try to build up your supply kit. And another important tip to remember is when you do go shopping for your emergency supplies, make sure you're only purchasing the items that you and your family may need during that event. I like to use now the scenario that we all saw all over the news during the beginning of the COVID pandemic, where everyone was stockpiling toilet paper for some unknown reason, and then nobody could find toilet paper anywhere. So again, just only when you go on your shopping trips, make sure you're only taking the items that you and your family are going to need, so that there are other items available for everyone else that is there trying to get prepared as well. So it's super important to know if you live in an evacuation zone and really to understand what that means. So the greatest loss of life during hurricanes is actually caused by storm surge. And storm surge is the water that gets pushed ashore by the powerful hurricane or tropical storm winds. So if you are unsure if you live in an evacuation zone, you can contact your county or local office of emergency, and they can assist you with determining if you live in a hurricane evacuation zone. Many counties, especially in the coastal states, also publish local hurricane guides, and those guides generally include maps with the evacuation zones, shelter locations, and that's just another resource that is available to you. You can usually find them online as well, or you can generally pick them up through local county offices or your local public libraries. You may also need to evacuate if you live in a manufactured home, even if you are not inside one of those designated hurricane evacuation zones. So it's very important to remember that if you live in an evacuation zone or in a manufactured home and you are ordered to evacuate, that you do leave. Always follow the instructions of your local officials, because they really will be providing you the best recommendation for your community based on the current threat. You also want to plan where you will be going if you do have to evacuate and leave your home. Will you be going to a hotel or staying with family members or friends possibly? If those are not an option, do you plan to use public shelters in your area? These are all things that you really need to plan in advance so that you're not scrambling to try to figure it out as the storm is approaching. As a dialysis patient, it's also very important to evacuate when you are told to do so. Remaining in an evacuation zone will likely make accessing treatment very difficult, if not impossible, following the impacts of a storm, because roads may be closed, transportation likely will not be running, and your facility may also be evacuated due to the storm. If a facility is an evacuation zone, they will be closed. So if you live in an evacuation zone, work now with your dialysis provider to determine where you will go for treatment if you have to evacuate. You also, oops, I clicked forward too soon. You also should practice your evacuation route in advance and know at least one alternate route just in case the main roads are crowded with other residents that are trying to evacuate. So it's a good idea if you, let's say you're evacuating to a hotel that's 5 miles down the road, practice a couple times which route you will take and even look at different alternate back roads or other routes that you could take. During some of the larger evacuations, I think it was back in 2017 when over like 1 million residents from Florida had to evacuate for one of the storms. People were stuck on the roads for 12 hours, if not more. So just, you know, plan those routes out in advance and look into alternate routes as well. You also want to make sure that you're making plans for all of your household members, and that includes your pets as well. So many states offer emergency sheltering during hurricane evacuations. The shelters should always be used as your last resort option. Back when I worked in the state of Florida, one of their big taglines was shelters are a lifeboat, not a cruise ship. You really should be planning to stay with your family or friends first and only resort to the shelters if you really have no other option. Of course, if the shelter is your only option, that is where you should go. As with last year, it's really important to stay informed and pay attention to the local guidance about updated plans for evacuations and sheltering. There may be, or there likely are, changes to the community sheltering plans due to the ongoing COVID-19 pandemic. They may be not opening as many shelters or reducing capacity in some of the shelters, or even looking at alternate sheltering options to try to make sure that they're able to still do the social distancing and follow other practices that were implemented due to COVID-19. So if you must go to a shelter, you want to be sure you include items in your Go Kit that can help protect you from COVID-19. Some of those are listed up here. You also need to be prepared to follow all of the disaster shelter policies and procedures. And that could include this year, as with last, a requirement to undergo daily or regular health screenings or temperature checks. You also could be required to wear a face covering while you're in the shelter. So it's important that you understand that there may be policies and procedures such as this that are a requirement if you do go to a shelter. And as a dialysis patient, you likely have a very restricted diet that needs to be followed. So it's important that you bring your 3-day emergency diet foods with you to the shelter. Most, if not all, shelters cannot accommodate special diets. So that's a very important thing that you need to plan for when you're preparing your Go Kit to go to a shelter. So most of those shelters, everyone will basically be eating the same thing. So they just won't have those food options available. So you need to make sure that's something that you're planning for if you do plan to evacuate to a shelter. So some additional items to consider when developing your plans. Does your community have a special needs or medical sheltering program? These are shelters that are specifically designed for people with certain medical needs. You'll want to contact your state or local emergency management officials to find out if your community has a program like this available. Most of these special needs or medical sheltering program do require you to meet certain medical criteria to qualify to come to the shelter, and you likely need to pre-register to go to that shelter as well. So you'll want to reach out to your local emergency management officials now. Don't wait until there's a storm headed for you. Do it now. Find out if there is a program like that available in your community, and then find out what you will need to do to see if you qualify and to pre-register for that shelter. If you are planning to evacuate the area or go to a shelter, make sure you discuss your plans with your dialysis facility in advance and determine where you will go for treatment. You also want to plan for how you will get to your facility or your backup facility. If your plans do change last minute, if you were planning to stay home and then you decide to evacuate, make sure that you contact your dialysis provider as soon as possible and let them know what your plans are now, so that they're not trying to track you down following the impacts of the storm. So you also need to ensure that you have alternate plans for transportation to your facility if you generally rely on public transportation services to get to and from your dialysis treatments. Public transportation in a lot of areas may be diverted to help assist with evacuating folks from the mandatory evacuation zones to shelters, or it may be shut down after the storm due to hazardous road conditions or flooding. And they also shut down public transportation once the winds reach a certain speed. So it's really important to talk about all of these things in advance and look at what other options you have available for getting to your dialysis facility after the impacts of the storm. So if you have pets, you want to make sure that you're including your pets in all of your plans. You don't ever want to leave your pets home if you are evacuating. So some things to really think about are that not all hotels and not all shelters accept pets. And even some of those shelters that do accept pets, they're restricted on what types of animals you can bring. And also sometimes they're breed restrictive as well. So you need to make sure you find pet-friendly locations when you're developing your evacuation plans. You could also even use buddy systems with your neighbors or family members and see if there's anybody that would be willing to help you. Let's say that you need to evacuate to a shelter and you can't take your pet. See if there's somebody that you know and trust that would be willing to help and keep your animal while you're in that shelter. Also remember that not all shelters will allow you to keep your pet with you. A lot of times the pet will be in the same building as you, but they will be separated from you. So that's just an important thing to remember. You want to make sure that you understand what the policies are of those specific shelters before you evacuate there. You don't want to show up thinking that you're going to get to keep your pet with you and then find out that they're going to be separated from you if that's not something you're willing to do. So just learn what options are available and make sure that you understand what the policies are of that shelter or of that hotel before you evacuate there. You can contact your local emergency management office or even your local animal control office to learn what options are available to you in your specific community. You'll also want to build a kit for your pets that includes essential items such as food, water, and then any medications that your pet takes on a regular basis. It's also important to note that the shelters generally, if you go evacuate to a pet-friendly shelter, you have to bring all of your pet's food, water, supplies with you to the shelter. So that's another thing to make sure that you're considering when you're doing your planning. So here are some key takeaways for today. I know we're all used to hearing this, but I think, you know, a lot of people, they get complacent and they look at, oh, you know, we haven't had a major impact here in, you know, over 20 years. And so they delay that planning until the storm, until they see that they're in the path of a storm. But really, you should not wait. You need to prepare now. Don't wait until that storm is headed your way. Make sure that you have all your plans in place in advance so that you're not scrambling last minute trying to find somewhere to evacuate to or someone that can help you with your pet. You'll also want to make sure that you continue to review the latest guidance from the CDC on COVID-19 and discuss with your family and care team on how it may affect your hurricane planning this year. You want to make sure that you stay informed and pay attention to local guidance about updated plans for evacuation and sheltering. And remember that the plans you had maybe last year or in 2019, they may have to change this year due to COVID-19. You may have pre-registered in previous years with a sheltering program, but it's possible that that shelter will not be available this year. So just make sure that you're continuing to stay informed and really paying attention to what is going on in your local community and to any changes they are making to plans due to COVID-19. And last, but definitely the most important thing to remember is you always follow evacuation orders and evacuate if you are told to do so. Emergency responders will not come out in the middle of a hurricane if you are having any issues. So you want to make sure that you evacuate from an evacuation zone if you are told to do so. So here we have listed some links to trusted sources where you can access tons of tools and resources that can assist you with developing your disaster plans, building your supply kits for your home or your Go kit. You can actually visit the KCER website, which is that first one listed at the top, www.kcercoalition.com. And here you'll find direct links to all of the other sites that are listed below, and you can review many ESRD-specific resources for disaster planning. So I really encourage everybody to have a look at all of these resources and to start your planning today. Do not wait. I think that was my last slide. It was. So Jerome, should I hand it back over to you on that?
Thank you, Keely. Lots of great information. And as a reminder to everyone, the recording of this call and the slides will be posted to the NCC website within 3 business days, so you'll have access to the slide deck. Now, we now want to hear your questions. If you haven't already done so, submit any questions you might have for Keely using the chat feature on WebEx. And we did have a couple of questions earlier. So I'm going to start with what we already have. Keely, do you have to have a COVID-19 vaccine in order to go to a shelter? Do you know that, if that's the case?
That's going to be very community specific. So you'll want to reach out to your local Office of Emergency Management and find out if that's something that's going to be a requirement. I've attended a couple of state emergency planning calls in recent weeks, and I have not heard that as a requirement on any of those calls I've been on. But I think it's very important for any sheltering related questions. A lot of times those are county specific or sometimes state specific. So you'll want to reach out to your local or state Office of Emergency Management to get that information for your specific community.
So for this next question, I'm assuming the answer is going to be pretty much the same thing. And the question was, Do you know if shelters are separating vaccinated people from unvaccinated people?
Yes, again, that's going to be very specific to your community. Some of them may be cohorting or using hotel rooms or other alternate options, but again, you'll want to reach out to your community or local Office of Emergency Management to find out what your specific community is doing.
Okay. Do you know what emergency planners are doing to prevent the spread of COVID-19 inside the shelters?
So a lot of them are following the guidance, mask wearing, social distancing, and they're really following the same policies and procedures as all of us have become very used to, doing regular health checks, temperature checks in the shelter. So there's a lot of different things that the shelters are doing to try to help prevent the spread of COVID-19.
Okay. And again, everyone, if you have a question for Keely, please submit your question using the chat feature in WebEx. Another question we have is, what can people do today or this weekend in the next week to prepare for hurricane season? What would you say is the top two things folks can do?
I'd say first and foremost, get your plan together. There's a lot of good resources available that are, even just a front and back sheet to help you get your plan for what you are going to do in the event of a hurricane. And also, as a dialysis patient, you want to make sure that you have all of your important medical information available and that you know what you are going to do to get treatment in the event that your facility is impacted. So those are the top two things that I would say to start with this weekend.
Okay. Is there any way to find out if a shelter has accommodations for PD exchanges?
Yes. Again, that's going to be very specific to the shelter. It's going to depend on what that specific shelter will allow and if they have space for it. So that's something you're going to want to reach out to your local Office of Emergency Management and see if they have a designated an area where that can take place within the shelter.
Okay. Another question we have is, how early before a storm hits my community can I ask for an extra supply of medication? So that, I hate that this keeps being my answer. That's going to be specific to what your state statute allows. So some states have it written into the statute that you can get an early refill on your prescription prior to a storm. So you're going to want to look at, you can even ask your pharmacist. I think that would probably be your best option instead of trying to look through state statutes. Either call your local pharmacy where you pick up your medications now and ask them what your specific state allows, how early before the storm you're able to get that emergency refill. Okay, thank you for that. And I believe this is going to be the last question, but it is, if I have to evacuate my home, my community, and go to a family member's home or a hotel that is far away, do I have to find the same dialysis facility that in the new area, or can I go to the facility that's nearest to me at the time? So I think they're asking if they have. Go ahead.
Right, if they have to go to the same provider. Generally, no. A lot of the providers they'll treat anybody that needs to be treated in the event of an emergency. But it's really important that if you are planning to evacuate, if you know where you're planning to evacuate to, you should talk to your dialysis provider ahead of time so that they can try to work with you and this alternate facility to make sure that there's a plan in place for you to get treatment there when you do evacuate. I also want to make sure I note that emergency planners don't suggest that you drive 600 miles or even out of state if you live in an evacuation zone. Generally, they just want you to get far enough away that you're no longer in that evacuation zone. So you may only need to evacuate 10 miles or maybe even less. You just want to get yourself out of that evacuation zone into a safe location. So you don't need to plan necessarily to drive out of state or hours away. So that's something to think about too when you're considering for your planning.
Yeah, thank you. Thank you for that extra information and for all of the information you provided us today. So we appreciate you being on the call.
Thank you.
Yeah. All right. So we'd like to share a few resources we have on the NCC website now. The first one is COVID-19, a positive test or under investigation, being prepared. It's a brochure for in-center hemodialysis patients who have been diagnosed with COVID-19 or are considered under investigation. It offers questions to ask your dialysis facility and the cohort facility if you are sent to a cohort facility. There are also suggestions for maintaining your emotional well-being. Visit kidneycovidinfocenter.com and select for patients to obtain that resource. Next, we have the My Plan, My Care resource. This document is to assist patients during the plan of care meeting, sometimes called the POC meeting. The POC meeting is a focused time to talk with your healthcare team about your dialysis care. During the POC meetings, your healthcare team will answer your questions and concerns about your dialysis plan, emotional well-being, and vaccination. You take this document with you to your next POC meeting. To get a copy, visit the patient section of the ESRD NCC website and select for new dialysis patients. And next slide, we want to remind you that we have a resource to help you find credible information about COVID-19. Please just visit kidneycovidinfocenter.com and click on the For Patients icon. And lastly, we want to thank you again for being with us this afternoon. For additional COVID resources, visit the KCER website at kcercoalition.com. Thank you, everyone, and have a great evening.